Speaking of sugar and urinary tract health, how does that go hand in hand?
Sugar can cause a lot of inflammation, and sugar is fuel for bacteria. And so when we are thinking of embedded infections, that bacteria will take that sugar and kind of help to grow. And so not only is it causing irritation to that bladder wall, to the bladder epithelium really in general, but excess sugar in the blood and in the urine can cause different aspects of the immune system to become more inflammatory. And so that those blood vessels that supply the bladder epithelium will also become irritated. And then, so you get a little bit of both. You get, unfortunately, some bacterial growth, and then you get some inflammation that makes the symptoms appear worse than they are. So sugar is definitely not a friend when it comes to bladder IC and to chronic bladder infections.
Well, and we think about the ultimate case of that, it's with diabetes, right? Diabetics have a big problem with sugar in their urine. I mean, diabetes mellitus, which is, the common form of diabetes that we hear about. Literally diabetes means siphon, mellitus means honey. So it literally means you are siphoning out honey. You are peeing out honey is literally what it means from, I think, Greek. And, as we know, diabetics have an issue with, a lot of urinary tract type issues because of that.
Yeah. And with diabetics, you start to have those microbes that you don't usually see, like fungus and Kleb, is one that really can show up. The abnormal infections come up with diabetics, which makes it even harder to treat. So that's why it's even more important to really focus in on increasing your fiber content, because fiber helps to pull that sugar in and use it properly, and lower just your sugar load in general.
Right.
But avoiding sugar-rich foods is definitely important.
So one thing I was thinking about, as a pharmacist, Janet and I, we're talking about diabetes mellitus and sugar in the urine. And there's actually a drug that was developed, Jardiance. I'm just going to say the brand name because that's what most people know it as. And I remember when it was developed and we heard the mechanism that it basically helped you pee out sugar. So it made your urine really concentrated in sugar. And we're like, think about the disease by diabetes mellitus. That's a problem. Yeah. Yet, we have a blood glucose number that we want to lower. So we give a drug to help them pee out the sugar. And lo and behold, it causes all kind of urinary tract infections. And it's not fixing the problem. I mean, The problem is carbohydrates. You're eating too much sugar, right?
Yeah, it's a temporary fix. And, that will make the lab values appear a little bit normal. And so, your A1C will go down for a little bit. But that underlying mechanism as to why it happened in the first place is not being addressed. And so you will become insulin dependent. You'll have further complications, deal with chronic infection, which causes a lot of inflammation. Then you get into what is the inflammation doing to your heart, your brain, your lungs?
Right.
And so it is a temporary fix for a long-term solution, which again, it's like, hey, if it, a lot of these studies look at patient outcomes within 3 to 6 months, maybe a year. And so if you're looking at more longevity studies, you can see actually, I don't know if it provides that much more benefit. So it's definitely something that short-sighted, but hey, let's get those numbers looking great, and then that makes us feel good. And then we'll
right.
the other stuff later.
That's kind of the way our healthcare system works in general. Is we put a Band-Aid on a bullet hole, and it's not really fixing the problem. And I mean, that's one of the reasons I like working with doctors like yourself, because you get to the underlying cause and want to fix the problem instead of just treating symptoms. And, sugar in the urine is just a symptom of diabetes. It's not really treating, like you say, the underlying cause, and then all the complications that come along with it. And like you say, outcomes are, the damage is done over years, and most people aren't diagnosed with diabetes until 10, 15 years post fact. So there's been a lot of damage done in the meantime. So that's why it's important to, go to a doctor that looks at, underlying causes and knows how to dive deep into it instead of just treating a number, right?
Yeah, and that's what we're starting to try to really push on a more global scale, is that preventative side of things. Because yes, a hemoglobin A1C will be able to detect blood sugar over a 3-month period of time, right? And so, the ranges for that, for the pre-diabetes, based off of what normal labs say, was 5.7 to 6.4 is that pre-diabetes, and then 6.5 and above is diabetes. And so, but what we're starting to find out is that hemoglobin A1C is sometimes we're catching a little bit too late. And so when we're even getting to that 5.5, 5.6, 5.7, we're fighting uphill, so to speak. And so making sure that your insulin levels, seeing what the insulin is, making sure that you're looking at your overall cholesterol, so your triglycerides specifically that are more focused on sugar, making sure that you're looking at your blood pressure, kidney function. Those things are important so we can help to identify things that might be warning signs. And obviously talking to each individual patient about your diet, your exercise, your lifestyle, all those things that are so crucial and oftentimes the hardest things to fix, but can be also the most rewarding things long term.
Right.
So yeah, it's identifying the precursors to it and not catching it when it's like, oh, we're too late.